If you've been dry brushing your skin by scrubbing hard in random directions hoping to detox your body, I need to stop you right there because you've likely been doing it in a way that could actually work against your lymphatic system instead of supporting it. In the next few minutes, I'm going to show you the exact technique that physical therapists who specialize in lymphedema use, the direction your strokes should actually go in, how much pressure to use, and the specific order to follow so that you're genuinely encouraging lymph flow rather than just irritating your skin. Stick around until the end because the direction of your strokes matters far more than most people realize, and getting it backwards can undo most of the benefit. Welcome back, everyone. Today we're diving into dry brushing, a practice that's become incredibly popular on social media, often promoted as a way to detoxify the body, reduce cellulite, or boost energy. But here's what most of those videos leave out. Dry brushing has real, legitimate roots in manual lymphatic drainage therapy, a technique used clinically by physical therapists to help patients with lymphedema, a condition where fluid builds up in the tissues because the lymphatic system isn't draining properly. Understanding the actual physiology behind dry brushing changes everything about how you should be doing it. Your lymphatic system doesn't have a central pump like your heart does for blood. Instead, lymph fluid moves through a network of vessels using the natural contraction of surrounding muscles, breathing, and gentle external stimulation, like specific brushing techniques, to keep flowing in the right direction, which is ultimately toward large lymph node clusters located in your neck, armpits, and groin. If you brush in the wrong direction or apply too much pressure, you're not helping that fluid move efficiently, and in some cases you might even irritate the delicate lymphatic capillaries just beneath the skin's surface. So today we're going to walk through the proper technique, step by step, the way it's actually taught in clinical lymphedema therapy training, so you can get real benefit from this practice rather than just going through the motions. Before we get into the technique itself, let's talk briefly about what dry brushing can realistically do, because setting the right expectations matters. Dry brushing is not going to eliminate toxins from your body in some dramatic detox sense, since your liver and kidneys already handle that job continuously and quite well on their own. What dry brushing can genuinely support is superficial lymphatic flow, meaning the movement of fluid through the thin network of lymphatic capillaries that sit just under your skin. This can help reduce the sensation of puffiness, particularly in areas prone to fluid retention like the ankles, and it can be a genuinely useful complementary practice for people managing mild swelling, especially when combined with movement and proper hydration. For people specifically dealing with lymphedema, a much gentler and more precise version of this technique, called manual lymphatic drainage, is often taught directly by a trained therapist. And if you have a diagnosed lymphedema condition, what we're covering today should be used as general education, not a replacement for guidance from your own treating therapist. Now, let's talk about what you'll need. A natural bristle brush is generally recommended over synthetic bristles, because natural fibers tend to be slightly softer and more forgiving on the skin, while still providing enough stimulation to be effective. Look for a brush with a long handle, which makes it much easier to reach your back and the backs of your legs without straining. The bristles should feel firm but not harsh, since the goal here is gentle, rhythmic stimulation, not aggressive scrubbing. Many people mistakenly believe that harder pressure means better results, but when it comes to the lymphatic system specifically, gentle pressure is actually far more effective, because the lymphatic capillaries sit very close to the skin's surface and respond best to light, consistent stimulation rather than deep pressure, which is more appropriate for muscle tissue than for lymph flow. Let's move into the technique itself, starting with the most important principle of all, which is direction. Every single stroke should move toward the nearest cluster of lymph nodes, which are primarily located in the neck, under the arms, and in the groin area. This means you're always brushing toward the center of your body and upward toward your heart, never away from it. This single principle is the biggest mistake people make, since many popular videos show brushing in circular motions or brushing downward on the legs, which actually works against the natural direction lymph fluid needs to travel. We'll start at the feet and work upward, since this is the order lymphedema therapists typically follow to support the body's natural drainage pathways. Begin at your feet, using long, gentle strokes, moving up toward your ankles, then continue up the lower leg toward the knee. Each stroke should be slow and deliberate, roughly 1 stroke per second, repeated about 5 to 10 times over each section before moving upward to the next area. When you reach the thigh, continue the same upward strokes, moving from the knee toward the groin area, since the groin contains a major cluster of lymph nodes that fluid from the entire leg ultimately drains toward. Once you've completed one leg, move to the other leg and repeat the exact same pattern, starting at the foot and working upward toward the groin. It's important to complete one entire leg before moving to the other, rather than jumping back and forth, because this allows you to work with intention and really internalize the direction and rhythm of the strokes. Next, we move to the arms, and the same core principle applies here as well, brushing toward the nearest lymph node cluster, which for the arms means brushing toward the armpit. Start at your hand, brushing gently up over the wrist and forearm, continuing up through the upper arm, all the way toward the armpit. Just like with the legs, complete one entire arm with several repetitions before switching to the other side. Now we move to the torso, and this is where the direction becomes slightly more nuanced because different areas of the trunk drain toward different lymph node clusters. For the abdomen and lower torso, brushing strokes should move upward and inward, gently guiding fluid up toward the armpits or down toward the groin, depending on which area you're working on, generally following the natural midline of the body outward toward the sides. For the chest and upper back, strokes should move toward the armpits on each respective side, since this is the primary lymph node cluster serving the upper torso. A helpful way to visualize this is to imagine your torso divided into 4 quadrants, with each quadrant strokes directed toward the nearest lymph node cluster, whether that's the armpit above or the groin below. Finally, we address the neck area, which requires the gentlest touch of all, since the skin here is thinner and the lymph nodes sit closer to the surface. Using very light strokes, brush from the base of the neck upward toward the jaw and ears, then from behind the ears downward toward the collarbone area, since this region drains toward lymph nodes near the collarbone. This area should only ever be done with extremely light pressure, essentially the lightest touch you use throughout the entire routine. In terms of timing, an effective dry brushing session generally takes between 5 and 10 minutes to complete thoroughly, and lymphedema therapists often recommend doing this in the morning before showering, since the light stimulation can also feel invigorating and help you feel more awake. While also allowing you to rinse away the outer layer of skin cells, the brushing naturally lifts. After brushing, following up with a shower and then moisturizing, the skin helps lock in hydration, since dry brushing can sometimes leave skin feeling slightly more sensitive to dryness afterward. There are a few important precautions worth mentioning as well. Dry brushing should always be done on dry skin, never on skin that's broken, irritated, sunburned, or affected by conditions like eczema or psoriasis in an active flare, since brushing over compromised skin can cause further irritation or even introduce bacteria into broken skin. If you have any diagnosed circulatory conditions, active infections, blood clots, or a history of deep vein thrombosis, it's important to speak with your doctor before starting a dry brushing practice, since stimulating fluid movement in certain circulatory conditions requires professional guidance specific to your situation. Similarly, if you have a diagnosed lymphedema condition, please work directly with your treating physical therapist to learn the specific technique tailored to your individual case, since lymphedema management often requires a more precise, medically supervised approach than general dry brushing for wellness purposes. It's also worth mentioning how often to practice this technique for the best results. Many lymphedema therapists suggest that daily practice, even just for 5 minutes, tends to be more beneficial than infrequent, longer sessions, since consistency helps maintain healthy lymph flow over time rather than providing only a temporary boost. That said, if daily practice isn't realistic for your schedule, even 3 to 4 times a week can still provide meaningful benefit, particularly when combined with other supportive habits like staying well hydrated, moving regularly throughout the day, and elevating your legs periodically if you're prone to swelling in the lower body. One more detail worth covering is how to properly clean and care for your dry brush itself, since this often gets overlooked. Because the bristles are in direct contact with your skin regularly, it's a good idea to wash your brush with a gentle soap and warm water every week or two, allowing it to air dry completely before using it again, since a damp brush can develop bacteria or mildew between the bristles over time. To bring everything together, the key principles to remember are these. Always brush toward the nearest lymph node cluster, meaning upward on the legs and arms, and toward the armpits or groin on the torso, depending on the area. Use gentle, light pressure rather than aggressive scrubbing, since the lymphatic capillaries respond best to a soft touch. Work in a consistent order, starting at the extremities and moving inward toward the trunk, completing one limb before moving to the next. And aim for consistency, ideally daily or several times a week, rather than occasional sporadic sessions. When done correctly, dry brushing can be a genuinely relaxing and beneficial addition to your routine, supporting healthy circulation and lymph flow, especially when paired with proper hydration and regular movement throughout your day. If this video helped clarify the proper technique for you, please take a moment to hit the like button, since it genuinely helps this accurate, therapist-backed information reach more people who might otherwise be doing this practice incorrectly. Subscribe to the channel if you haven't already, because we bring you clinically accurate health and wellness content just like this every week. If you have any questions about specific areas of the body, or if you're managing a diagnosed lymphedema condition and want to know more about how this differs from clinical manual lymphatic drainage, drop a comment below and I'll do my best to help point you in the right direction. Take care of yourself, share this with someone who could benefit from doing this correctly, and I'll see you in the next video.